Dr. Farhan Siddiqi, the medical director at Florida Advanced Spine and Orthopedics.
Patients often ask me, what is degenerative disc disease? The discs are within the spine, and they are the cushions between our bones. They are filled with a jelly material like a tire is filled with air. Degenerative disc disease is a condition that occurs when the jelly deteriorates and the disc flattens, just like a tire that gets low on air. Most animals, like dogs and cats, walk on 4 legs, so their spine is horizontal. Humans, however, evolved to walk on 2 legs. Thus, our spine is actually in the wrong position. Nature never designed our discs to hold up our body weight. As a result, our core muscles, including our abdominal, our flank, our back and neck muscles, if they're not as strong as they could be, or if our weight is more than it should be, then our daily activities of life, our sports, our jobs will cause compression of the discs, and over time the jelly inside will deteriorate and the disc will flatten, like that tire that's low on air. We start by treating this condition conservatively by strengthening your core muscles and reducing the inflammation in your spine with anti-inflammatory medications. If the discs are not completely collapsed, we can repair the disc and stabilize the collapsing jelly. This is done by transplanting new disc material into the disc with a needle, either from your own body stem cells or donated disc cells. Regardless of how degenerated your discs have become, there are a number of treatments for you at FastMD. Starting as simply as strengthening your core with physical therapy and using your body's stem cells to repair your discs, all the way through completely reconstructing and replacing your damaged discs with major surgery. To learn more about these treatments, please contact our office or visit us on the web at fastmd.com.